Hello. You or a member of your family has been diagnosed with an irregular heart rhythm known as atrial fibrillation or AF. Normally, your heart's natural pacemaker makes your heart beat regularly. In AF, lots of random electrical impulses take over. These cause your heart to beat abnormally, irregularly, and often very fast. If AF is present all the time, it is called persistent AF. If it only happens some of the time, it is called paroxysmal AF. AF can cause shortness of breath, dizziness, and palpitations, although some people with AF experience no symptoms. Having AF increases the risk of a blood clot forming inside your heart. If this clot travels to your brain, it can block a blood vessel, leading to a stroke. If you have AF, you may need medicines to help your heart to beat regularly, slow down your heart rate, and reduce your risk of a stroke. Anticoagulants are the group of medicines used to stop the formation of blood clots in AF and reduce your risk of having a stroke. The two main types of anticoagulants used in AF to reduce your risk of a stroke are warfarin and direct oral anticoagulants, or DOACs. The type of anticoagulant you will be offered depends on the cause of your AF and your personal circumstances. This includes your past medical history, lifestyle, and any other medicines you are taking. For a long time, warfarin has been the drug of choice in preventing strokes in AF. But in more recent years, DOACs have been shown to be as good at preventing strokes as warfarin. The main differences are that with DOACs you do not need to have frequent blood tests like you do with warfarin. The effect of a DOAC is more predictable, which means you do not need to change the dose on a daily basis. DOACs are also less affected by what you eat. Your doctor, pharmacist or nurse will discuss the risks and benefits of both types of medicines with you. If you are prescribed warfarin, you will take a mixture of different strength warfarin tablets at the same time every evening. The dose of warfarin you need to take is based on a regular blood test called an International Normalization Ratio, or INR for short. If you are prescribed a DOAC, you will either take one tablet once a day or one tablet twice a day, depending on which DOAC you are prescribed. Once you are diagnosed with AF, it is likely that you will have it for the rest of your life. This means that you will always need to take an anticoagulant to protect you from having a stroke. In some circumstances, your doctor may try to treat your AF with an electric shock to your chest or a small operation to your heart. These treatments are only possible in specific situations, and particularly in younger patients. Even if your AF is treated, you are likely to need to continue taking your anticoagulant.